Real Life Wellness brought to you by Boiron. For colds, coughs, and flu, safe and effective medications for the whole family. Boiron.
For many Canadians, winter doesn't just mean Christmas and cold weather. There's a change in temperature all the time, which can lead to all kinds of different viruses like cold and flu. Now, during this busy festive season, we don't have time to be sick, so we want to find ways to help boost our immunity and feel better during cold and flu season. Well, what better place to find out some tips than at a pharmacy? We're here in downtown Georgetown at a pharmacy that's been in operation for more than 50 years, serving its local community. And we're going to go inside and talk to both a pediatrician as well as a pharmacist from Young's Guardian Pharmacy and ask them what they're recommending to their patients during this cold and flu season. Pharmacists are one of the first healthcare professionals that we often seek advice in trying to find ways to help with cold and flu symptoms. So what better person to have with us than Randy Carman, who is the pharmacist here at Young's Guardian Pharmacy. Welcome, Randy.
Thank you. Welcome to our community pharmacy.
Yes, and 50 years at that, helping patients. That's fantastic.
That's right.
So at this time of year, what type of questions are you seeing from your clients during cold and flu season?
Parents are currently looking to find out what products they can use with the current guidelines to treat the cold and flu signs and symptoms, such as runny and stuffy nose, cough, aches and pains.
Right. Right, and as a parent, of course, those are the ones that keep our children up at night, which keep us up at night as well. So as a pharmacist, what types of things, now with the Health Canada advisory, what types of things do you suggest to clients?
Well, I've used the Stodol myself when my 3-year-old had a cough a couple of weeks ago. And
right.
He enjoyed the taste of it and it worked very well.
Right. Now, why Stodol? Why is this safe and okay to use?
Well, compared to the other over-the-counter products that are now recommended for 6 and over,
right.
The ingredients in it are recognized as safe by Health Canada. There's no side effects or interactions with other medicines.
Right.
And it can be used by any age group or high-risk patients or people that can't be drowsy at work.
Right, and as you said, it tastes good, doesn't it?
Yeah, it tastes
I've used this product, but it's great to know that we can come to a pharmacy, seek advice from a professional like yourself, and actually have an option to give to our kids. Well, thank you so much, Randy, for having us into your pharmacy today, and we'll be a lot happier having options like this in our medicine chest. I'm really excited to have with us Dr. Natalie Stern, who's a pediatrician and homeopath. And today we're going to talk to her about the difference between cold and flu and what she recommends to her patients to help keep them as healthy as they can during this cold and flu season. So welcome, Dr. Stern.
Hi.
Good to see you.
Nice to see you again.
Okay, so cold and flu season is here, but I know there's a lot of confusion about the difference between cold and flu. Can you tell us the differences between the two?
Sure. Viruses are both responsible for cold and flu, but there is a lot of viruses who give cold symptoms, and they're usually pretty benign. You know, you've got a little bit of runny nose, can get yellow, but just a couple of days, a little bit of sore throat, a little bit of cough, low-grade fever, but usually after a week you're fine and you were able to run your errands blowing your nose, basically. Flu, the viruses responsible for flu are called influenza viruses, and they're much more aggressive. Some of them get lucky and just have cold symptoms, but most of us have high fever, headache, body ache, we swamp, we're in bed for a week, and there is much more risk of complication, especially pneumonia, and sometimes death on fragilized individual, and that's why it's recommended to get immunized.
Right. Now, when should we as parents be concerned to seek medical attention, whether it be with a cold or a flu?
Well, the rule of thumb in pediatrics is the youngest the child, the fastest you should seek medical attention. And definitely any child under 3 months of age with fever, no matter what, should see a medical doctor. Now, if you're anxious or if you have any doubt, you should seek medical attention. Having said that, for a cold, usually high fever doesn't want to go down, kids look sick, new symptom, rash, gastrointestinal symptom, pain, symptom will persist, or any sign of respiratory distress, definitely you should seek medical attention. For flu, you should seek medical attention or at least advice right away to make sure that you're not in a category of population that needs specific treatment fast.
Right.
Once you're reassured that you're not in this category of population, then the red flag are about the same that for cold. You know, high fever, looking sick, you know, not getting better, respiratory distress, definitely.
Right. Now, as a healthcare professional, I'm aware, and I'm sure a lot of our viewers are aware, because if they've seen their doctors, there's a Health Canada advisory that was put out earlier this year about over-the-counter cough and cold remedies for children under the age of 6, and that they need to be relabeled. Can you tell our viewers a little bit about that health advisory and why it's in place?
Yes, this advisory actually from Health Canada is pretty sensitive, and it's based on the fact that on one hand we know that over-the-counter cold and cough medication for children are not really very efficient, and we know that there is potentially some risk of secondary effect from misuse or overuse of this over-the-counter medication. So it's kind of logical not to use it, especially for a benign ailment like a common cold.
Right.
So we can do other stuff. You know, we can let the cold run its course and trying to make the body as strong as possible to fight the symptom. And it's a lot of rest, a lot of fluid.
Right.
Chicken soup, never
Yes, of course.
underestimate the power of it. And as a homeopath, I recommend some homeopathic medication, which are like totally safe and have no secondary effect. So the one I liked personally is Corizalia, which is a homeopathic medication who contain a list of different homeopathic medication triggering specific cold symptom. And it's actually very easy to take because it comes in little ampoules.
Right.
You just snap the tops and squeeze it in the patient's mouth.
Oh, okay.
Okay.
So, and I mean, that can go in your purse.
That can be in your purse.
Yes.
And then that's for no nasal congestion and runny nose. No for cough, there's a cough syrup called Stodel, and it's actually tastes very well, tastes like honey, so kids love it. And same thing, this is homeopathic medication, so very safe, no secondary effect, as long as you know what you treated, which
Right.
is the common cold.
Well, and I can speak firsthand for Stodol in particular. This is a dynamite product. What I love about it, not only does it taste delicious and the kids want to be able to take it, it really works and helps with those sleepless nights when the kids are up coughing. But what I also love about it is that I can purchase it, have it in my medicine chest, and I can use it as well as my children. So we'll have one medicine for the whole family.
Yeah, which is actually not the case for conventional medicine. You should never use, you know,
Right.
adult cold medicine
Exactly.
for children.
Right. Okay, so now flu. So if we've come down with the flu and we're ache and pains and headache, all of us, we hate the onset of those symptoms. What, as a homeopath, do you recommend?
Well, first I recommend, once again, to call your primary care physician, making sure you don't need any specific
Right.
medication for your condition. Once he reassured you and told you, no, just stay home with your chicken soup, as a homeopath, I do recommend a medication called oscillococcinum, which is a natural flu medicine, and it's actually the #1 natural flu medicine in France. It's very famous in France. And same thing, it's very easy to take. It comes in little tubes like that, and you remove the tube, obviously, as soon as you feel that, you know, achy and you're like brewing the flu, you take the whole tubes, the pellets, there's 200 tiny pellets inside,
Right.
under your tongue, let them melt under your tongue, okay? If you have a smaller child, that you can eventually dissolve it in water.
Oh, okay. Right.
And then, so one tube at the first onset of the symptom, the second tube 6 hours after, and the third tube 6 hours after the second one.
Okay.
So it's 3 tubes 6 hours apart.
And I know as well, this has been a huge success in my house. My son came home with the flu earlier this school year, and the first thing, what's neat about it is they start to ask, Mom, where's the oscillococcinum? And out it comes, and like you said, dosed according to the recommendations, really effective, and he was feeling better, shortening the duration of those horrible aches and pains.
Yeah.
So, well, thank you as always. Such great information to share and to help our viewers at home be healthier and happier during this cold and flu season. So thanks for sharing all your great knowledge with us.
Oh,